3, 2, 1.
Hello, everybody, and good noontime to you. I want to thank everyone for joining us here virtually at Chapman University in the city of Orange for this Community Impact Forum. I want to share with you for a moment the purpose of the Community Forum, which is to share with a panel of very engaged community citizens, both of the university and of the community, some really important work that has been undertaken in response to the coronavirus pandemic that's affecting our community as well as the entire globe. I want to introduce to you the panel that will be speaking with you today about this important matter, which is the involvement of Chapman University in the life of the city and our community, of which we are, many of us, and of course everyone works, but also lives in this community. So we are looking for ways for to share what has been ongoing in response by faculty, students, administrators in this context, as well as to engage you all who are interested enough to join us today in both asking questions about what we can be doing, what we are doing, and also to share your ideas. So we want to spend the next about 35 minutes with the panel to present what's ongoing and then to leave time for sharing ideas. So let me tell you who is on the panel today. Mayor Mark Murphy, Mayor of the City of Orange, is with us. President of Chapman University, Daniele Struppa. Vice President for Research and Professor of Environmental Studies and Policy, Tom Piechota, as well as Dean of the Crean College of Health and Behavioral Sciences, Janeen Hill. And Andrew Lyon, Dean of the new Fowler School of Engineering. Ron Jordan, who's Dean of the Chapman School of Pharmacy, and Jack Raubolt, who is VP for Community Relations. Many of you know him, both here on campus and in the community. So I'm your moderator. My name's Collette Creppell. I'm Vice President for Campus Planning and Design here at Chapman University. And let me just remind everybody that you have the ability through the live chat to submit your comments and to submit your questions, and we're looking forward to getting to that. The one other thing that I would just mention before I turn the screen to Mayor Mark Murphy is that I'll share the experience that I was in New Orleans as a former city planner and campus architect at Tulane when Katrina hit. That was almost 15 years ago. And while there are many, many differences between the event of Katrina that was so physically devastating in a very specific locale to this, which is a pandemic affecting everyone around the globe, there are some parallels and there are some lessons that I might highlight in just moments, which is to say that if there were lessons from that particular tragedy and crisis, and we're both have lived through that and now are living through another at a larger scale. I would say that the lesson is that resiliency, optimism, and creativity, and those are the things you're going to hear about today, are those factors that really allowed, say, in that context, a community to pull out of a crisis and actually find opportunity. Whether it was, re-engineering an entire school system, to radically rethinking the way the city was organized, there are opportunities in the time of crisis and tragedy, and it is really wonderful. It's my honor to turn the screen to those who have been already on the front lines with that positivity in response to our circumstance. So I'm going to turn the screen to Mark Murphy, Mayor, City of Orange.
Hey, thank you very much, and thanks so much for the kind invitation to participate today. You know, in times like this, it's incredibly important to have these sorts of vehicles to communicate, exchange ideas, and really rethink and think how we're going to proceed forward. So I really appreciate the opportunity. March 16th was the day where we adopted the resolution ratifying that there's a local emergency as well as a national and international emergency. And from there, we took on a number of things that have never been done before in really trying to prepare for this pandemic as well as work our way through it and out. First and foremost, I have to say thank you to all of our first responders, all of our essential workers, and certainly all of our partners, including Chapman University, for forging this path together rather than on an individual basis, whether it be the university, whether it be our hospitals, whether it be our stores that are staying open, the workers that are making sure that we have an opportunity to have food in the pantry and service to our vehicles and the rest. I can't say much before I want to say thank you for everyone involved. We, like many entities, went into an emergency mode. We opened an emergency operations center that continues to be in operation today. We closed multiple facilities. We implemented a modified level of operations with telecommuting. One important point that I want to make sure that everybody recognizes is in terms of first line support, your 911, public safety, police, fire, ambulance, and health, we are at full strength and continue to run at full strength. And I'm happy to say as well that so far we have no positive cases amongst our city family related to the virus, and we are blessed that that is in the case. But we continue to work with all of our partners, Chapman University being at the front of that list, along with our hospitals, our federal, our state, and our local county leaders to try and forge this path now that we're in 5+ weeks, how to forge the path forward and what the next steps are, and hopefully start to get an expectation of when those steps might start to move. I want to say a couple things. True partners step forward in times like these, and Chapman has certainly been great about that. Whether you look at the farmers market continuing to operate and providing food and shopping and the rest, whether you look at and think about the kind offer for facilities for our first line employees in the dorms should they need to isolate themselves on the basis of a threat, and just working together, our safety services and the rest, to address this as best we can. We're forging new ground here. I'm amused that they call it social distancing, right? Well, there's nothing social about this. This is something new. This is something different. And I think what we got to do and continue to do, and what motivates me, is all the people I talk to that come up with new ideas, new ways of looking at things, and maybe at the end of this, we're going to come out better on the back end. It's going to be painful for a while and will continue. But I think from my perspective, at least, I'm optimistic about the results, and certainly our residents, our businesses, and everyone involved with the city of Orange has been really, really patient and really, really good during very, very challenging times. And it's certainly not lost on anybody down at City Hall. So those are just some opening thoughts. I look forward to the questions as well. And again, I can't say thanks enough to Chapman University for putting this together, and President Struppa, Daniele, a good friend as well as a good colleague and a good partner. And I'm gonna toss it your way for some thoughts from your end. I've talked enough today.
Thank you very much, Mayor Murphy. I want to thank you, first of all, for being here with us, for accepting our invitation, for being the friend and the supporter that you are. Thank you for that. I want to thank you on behalf of the entire city, for your tremendous leadership. I think you really have taken hold of this very difficult situation with the kind of response and positive attitude that I think is going to make the entire difference. I also want to say thank you to all of you who are right now attending this virtual town hall for joining us. We really appreciate to speak with you. So I joined Chapman about 15 years ago. I remember in one of my very first meetings, I asked my faculty to imagine what would happen if Chapman were to leave Orange, were to leave the community. Would anybody care? Would anybody pay attention? And I think that was my way to remind all of us that we take our role as community members very seriously. it is important that we think of ourselves as an integral part of this wonderful community that is the city of Orange, and more largely Orange County, with our location also in Irvine. We need to think of ourselves as active members of a community in a constant process of give and take. We benefit from the beauty of the old town Orange, and that's something we always showcase to our incoming students and their parents. And we think that we are important partners in the growth of the city. And so we want to be part of this community as we face this pandemic. And that's why a couple of weeks ago, I reached out to our mayor, and we had a wonderful conversation. And that's how the idea really of this town hall came about. We talked about and we said, how can we join forces? I mean, we are clearly trying to deal with this pandemic in ways that are mutually supportive. And so we thought that maybe having a town hall would be a way to receive input, answer questions, and give us food for thought. So I'm very appreciative of this happening. As the mayor has hinted, we are making available some of our housing to the city of Orange. You know, we have beautiful apartment-style housing in our Panther Village, and of course we have no more students on campus now, or only very few, but none of them is in Panther Village. And so we are making those apartments available to the city of Orange first responders when they need to self-isolate should they become potentially exposed to the virus. We are proud of doing that. It really gives me great pleasure that the city is interested in working with us, and we are able to offer a hand to those people who are really the first line or the front line of this battle. I also think that you see our commitment to the city and to the community by just looking at the people that are going to be representing today's panel. You met Collette, our Vice President for Campus Planning, and the moderator of our panel today, and you will talk soon with Jack Raubolt. You have met him many times. Jack has been a great presence in our city. He's been in contact with many of you directly over the last several years as our Vice President for Community Relations. I'm also proud because we are a university, and what do universities do? Well, essentially we do 2 or 3 things. One of them is we teach. We teach students, we prepare students for their future, and we haven't stopped doing that. Despite the virus, we are all in our classes, this time from home. You can see I'm here in my office at home, and I teach from here right now, and we are keeping our mission as a teaching institution. But we are also researchers. We produce new research. And one of the things that I'd like for you to hear today, you're going to have from our deans a glimpse of the kind of research that we are offering that has impact on the pandemic. So it's not just the usual research, but what can we do that makes sense for all of you? And finally, I should say that we are here to listen today. We are here to hear what your concerns are. How can the city help you? How can the university help you? What can the two of us do together better than what we will be able to do if we're in isolation? Thank you very much again for being here. And now I would love to pass the baton to our Vice President for Research, Dr. Tom Piechota.
Great. Thank you, President Struppa. So it's a pleasure to be here today. I do want to thank the mayor and also President Struppa for his leadership and guiding Chapman through these extraordinary circumstances. As the president said, I'm here to talk about some of the extraordinary research that Chapman is doing and the experts at Chapman. What I found was in circumstances like this is an opportunity, and that's what Collette talked about, was how do you use something like this as an opportunity to engage your community, engage the experts at the university on what's going on. And that's what we've been doing over the last over a month now, in terms of Chapman has extraordinary experts and extraordinary students also. So some of the things that we've been doing over the last over a month now is engaging our experts and really allowing them to be trusted voices and answering many of the questions that are in the community about the coronavirus and COVID-19. Some of the things that we did, starting on March 26th, we had our first Ask the Experts virtual town hall, and we've had 3 of those since then. And we've had over 500 participants in each one of those town halls. We've had experts that they speak on just what's the current state of cases and where is it being projected, to issues around how is it impacting air quality issues, and what are some of the health concerns that people should be answering some of those health issues that people have. We have experts that are working in partnership with Facebook on looking at the connectivity of communities and how that can help decision makers in terms of how communities are connected between each others and how that impacts the vulnerabilities of communities. We'll be having another one on Monday on the 27th. So we'll be having our President Emeritus Jim Doty talk about really a critical issue for our community is really how do you restart the California economy. Jim will be giving some comments on that. Dean Jennifer Keene will be talking some on reflecting back to the 1918 flu pandemic, and how this relates to that. Jason Douglas in the Crean College is looking at some of the health disparity issues, and then we have some of our engineering faculty doing some great work and outreach with the community that they'll be talking about. And then the last thing I want to just touch on is we've been able to support some of our faculty on really important projects too, and with the help of outside community partners too. With the generous support of the K Family Foundation, we were able to support some rapid response projects that directly answer some of the questions of the coronavirus COVID-19, looking at some of the psychosocial issues related to what are some of the mental, physical, and social well-being issues, both that our students are facing and both that the community are facing too, and better understanding those. So it's not just the health issues, but there's other well-being issues too. And then, as I said, looking at some of the health disparity issues that they see, particularly in LA and New York also, that we'll be looking closer at. So that's a little bit of glimpse in terms of what we're doing in research. You'll be hearing more from some of our deans in terms of what's happening in their specific colleges. And with that, I'm going to turn it over to my colleague, Dean Janeen Hill, to talk about what's going on in the Crean College of Health and Behavioral Sciences.
Hello, everyone. It's really a great pleasure to be here today. I just want to say a little bit about Crean College and how Crean College started thinking clearly about Daniele's, or the President's Challenge, that we need to be important and embedded in our community. And so one of the hallmarks of our college has been our deep commitment to making a difference in our community. So you can see this in the various stroke and Parkinson boot camps that we hold, our childhood language facility in Santa Ana, in the Francis Smith Family Therapy Center that we have in Orange, that these are free services that we offer children, adults, teenagers, and seniors who are suffering from both mental and physical disabilities and diseases. So those are things that our faculty, you will find us in our community today, and you'll also find us in our community tomorrow. But what's happened is all of these things that we have done that have been based on face-to-face interaction has had to change quickly. And we've had to say, how do we continue to be relevant and important to Orange and to Orange County? How do we continue to reach out and help people when we can't do that in person? And so we've really pivoted to the virtual space. And I'm going to talk a little bit about the Marriage and Family Therapy program and the Francis Smith Center for Individual and Family Counseling. I don't know that many in Orange know that this is a center that has actually existed since 1969. It began because there was a need to work with returning vets from Vietnam and their families who came back and were pretty much left to their own device to deal with their trauma. So since 1969, this center has been on the Orange campus and has worked with free of charge with people who are suffering from anxiety, from interpersonal relation trauma, But today we've quickly pivoted. Now we are a telehealth center. And right now for the community members in Orange, we are offering free community session, healthcare sessions for those that are experiencing the great loneliness that we feel when we are socially isolated, the challenges of parenting in a very small space, while you are also trying to have students take classes and you are doing your job. And for those that are really experiencing great fear of a disease. So you can actually have free telehealth mental health counseling sessions through our Francis Smith Center. And all you need to do is to call the following phone number. I'm going to read it off so that I don't get it wrong. 714-997-6746. Once again, 714-997-6746. You press option 1. You leave a message, and your messages are returned on Tuesdays and Thursdays, where you will be scheduled to have one or a series of mental health sessions. The center is also rolling out in the next 2 weeks group therapy sessions for our first responders and for those on the front line. As Mayor Murphy talked about, we have just heroes in Orange that are doing this work every day. And that takes a mental toll on folks. And so our Francis Smith Center is rolling out free sessions for these groups of folks. And once again, please call the phone number and someone will get back to you with information in how you enroll in those free sessions open to you. Another group that I'd like to call out and talk to you a little bit about is our faculty who are teaching our future physician assistants. So in the Crean College, we have a graduate program in physician assistant studies. Right now, our faculty are giving up their weekends and their evenings. They are working in our local ERs, ICUs, and other healthcare facilities where folks with that are struggling with the disease of the coronavirus, that they are treating these people on their own time. Even though these folks have families at home, they have decided that their professional responsibility to treat the ill is the most important thing that they can do and that they can give back to community. So those are just a few things that the college and its faculty are doing to make sure that we are engaged with you and helping you cope with what is just this extraordinary time. And there's lots more I could talk about, but there are other people to hear from. And so if there's any questions, I'm happy to engage those in the Q&A period. But right now, I'd like to hand the baton to Andrew Lyon, who's the founding dean of our Fowler School of Engineering. Andrew?
Thank you very much, Janeen, and thanks everybody for joining us. This is, I think, really a wonderful event. Huge number of people online listening to us and engaging. As Janeen indicated, I am the dean of the Fowler School of Engineering, which we're in our first year. We're going to graduate our first class here shortly. And so these are exciting times as we ramp up the brand new engineering effort here at Chapman. As President Struppa said, we're here to teach, we're here to do research, and in particular, as a School of Engineering, we make stuff. And we've really leveraged all of those things in our efforts to respond to the community and really engage in some, I think, hopefully impactful and meaningful ways. One particular area that I think is exciting is related to something that's become part of the daily conversation, and that is, how do we provide PPE for our healthcare workers? We hear every day in the news about all the shortages, and our students and faculty responded to that in a pretty remarkable way by 3D printing frames for face shields that the workers can wear while they're dealing with critically ill patients. And up till now, over the last 3 weeks, we've actually made around 3,000 face shields. Our faculty in Fowler Engineering, faculty in Schmid College of Science and Technology, and through our joint program called the Grand Challenges Initiative, we've leveraged this really nice distributed model of manufacturing and fabrication to create a remarkable number of face shields. One of the ways we've been able to do that is by recognizing some interesting and novel ways to disseminate the education around 3D modeling and manufacturing. One thing that we've done, and we decided to do this over a year ago as we developed our new additive manufacturing courses, is make sure that every single student had their own 3D printer in their hands that they could have in their home, in their dorm room, in order to make their projects. John Humphreys, who leads that effort on our faculty, has now turned that on its head and turned that into a distributed manufacturing model where all of our students all over the country are making PPE for healthcare workers as part of a service learning component of their 3D printing course. As I said, those students and faculty have now made more than 3,000 face shields for first responders, and we've delivered those across the country, including right here in Orange to St. Joseph's. Another way we've attacked this through novel educational approaches is recognizing that a lot of students in high school right now are maybe not feeling like they're getting precisely the education that they wanted, especially as it relates to computer science. This is a big stress for lots of families as they think about their high school seniors going off to college and maybe having thought they were going to be prepared educationally, but feeling less certain about whether they're going to make that transition to college seamlessly. So Eric Lindstedt and Elizabeth Stevens in Fowler Engineering decided to launch a 5-week free online computer science course that teaches Python and computer science fundamentals. And they're teaching that free of charge online, and I've enrolled, I believe, around 150 students in that from the local community and across the country. That's really been remarkable. They've stepped up to the plate and they've recognized one of the biggest stressors for students as they enter the challenging and rigorous programs we have in Fowler Engineering might be their ability to simply understand computer science and write code. They've had corporate partners at Zybooks donate educational materials free of charge for those efforts, and that's been remarkable to see the community come to the plate in terms of industry relationships. Finally, when I first stepped into this role a little over a year ago, one of the most important things that I thought we could do is make sure we had robust connections to our local high schools and middle schools. That includes first, just getting in front of the folks at Orange High School who we've had a long relationship with. But as you launch a new engineering school, people have lots of questions about what that really means. And so we went out and we built lots and lots of very specific relationships with high schools to make sure they understood what types of unique educational programs we were going to build, and also what kinds of financial resources we would have to make engineering education accessible in Southern California in ways that it wasn't maybe for many, many students who typically can't afford to access a really fantastic engineering education. Now, as we fast forward to the current crisis, those relationships are paying dividends as we can now reach out to those students and those families who are maybe having some real difficult times financially because of the local economic circumstances and the global crisis. And we've been able to, I think, step up to the plate and make engineering education available to those families and to those students in ways that they didn't think would be possible given the loss of income and the loss of jobs. And so those are some things that we're really proud of. The faculty and the students have all come together, and the staff have really banded together to make sure that we're communicating robustly with each other, that we're sharing ideas that can impact the community. And as Janeen said, there's lots more things that I could speak to, and I'm happy to answer any questions in the Q&A. With that, I'm going to throw things over to Dean Ron Jordan, who leads the Chapman University School of Pharmacy. Ron?
Thank you so much, Dean Lyon. Before the pandemic and continuing today, we have about 25 faculty working in hospitals, health systems, ambulatory care clinics, and community pharmacies to keep people safe with their medicines. We're also
any one time, nearly 200 students are out on various forms of internships, residencies, and experiential education rotations in the same sites. Our school has about 200 alumni now, and they're out there working on the front lines of the COVID response around the nation. As the virus affected our healthcare system and as institutions prepared for the predicted surge, some of our work had to switch to telepharmacy delivery of pharmacist care and comprehensive medication management. Fortunately, we have had faculty researching that area for a number of years. Our 25 research faculty also entered the fight early by gathering up and donating nearly 2,400 items of personal protective equipment from their laboratories to St. Joseph Hospital in Orange and Chalk Children's Hospital, where the frontline workers were in dire need of more protective gear. As there were some of our own Chapman community in those institutions, I was proud to see our faculty respond. Today, we have a limited amount of research going on related to COVID and a unique, inexpensive, and easily deployed test for asymptomatic testing of COVID infection, and that work is moving very rapidly. As you may be aware, community pharmacies are especially important now in keeping people safe when they are quarantined or visiting the pharmacy to obtain their chronic disease medicines. I thought I'd focus briefly on community pharmacy practice for a few reasons. First, it's essential to recognize that medication therapy is one of the most frequently encountered forms of medical treatment, and that pharmacists are our best trained medication experts. Pharmacists are also the most accessible healthcare provider and most frequently encountered. There are pharmacies within 5 miles of every citizen in the United States, many of them open 24 hours a day, 7 days a week. On average, an American citizen visits a pharmacy dozens of times a year when they only see a physician about 4 times on average. Another reason to focus on this area of practice is that most COVID vulnerable elderly citizens use a lot of medication obtained from community pharmacies. Their safety and the use of drugs in COVID response is particularly critical in the elderly. There are risks and challenges with some proposed therapy that need to be more widely understood. Finally, I think it's vital that pharmacy is seen as an essential part of the healthcare response system when it comes to COVID, a point that's sometimes overlooked. Community pharmacy has developed 400,000 trained immunizers over the past 2 decades. This workforce will ultimately be crucial in ending COVID-19 through large-scale rapid deployment of serology and infection testing, delivery of a vaccine, or maybe a miracle therapy that needs to be rapidly and vast-scale deployment. Recently, the Secretary of the Department of Health and Human Services recognized that pharmacists delivering COVID testing in the U.S. is an important part of the emergency response. This and previous administrations have repeatedly recognized that pharmacists are well positioned to deliver this and other critical patient care services at vast scale. In all 50 states and territories, pharmacists can initiate and administer vaccines. In fact, it's been widely acknowledged that pharmacist immunization delivery efforts were seen as the most important reason that the 2009 H1N1 flu pandemic was not as bad as it could have been in this country. Pharmacies have sophisticated, rapid supply chains, online real-time data exchange, and important vaccine and testing reporting capabilities in real time that can be deployed. Immunizations are reported in real time currently to state and ultimately federal immunization registries. Our graduates and community pharmacy structures in California are ready to help and prepared with the tools we need. I'll stop there and I'll look forward to questions. Let me now turn it over to Vice President of Community Relations, Jack Raubolt.
Good afternoon, everybody. It's nice to be able to meet with you. I miss being out in the plaza and in different meetings, but we're all getting through this together. So I'm just going to run through a few things. The Community Relations Office is still open. We have our neighbor's phone line, and the email is being constantly checked. We've had some calls from residents that are worried about the students not practicing physical distancing or wearing masks. If you have those concerns, please give us a call and we'll see what we can do. We also have had a couple complaints about the noise during the day by neighbors who are working at home and teaching their children at home. We're contacting those students the best we can, and we're still doing the liaison visits when necessary and possible. Dr. Price also puts messages in his weekly email and other communications with the students addressing the things above. So if you have an issue, please let us know and we can address it for you. Some of the things that we've been working on is one, we've been working with the Chamber of Commerce a lot to get the word out that Orange is open. There's an actual hashtag out there, hashtag Orange is open. It's a program we've developed. It's the merchants and restaurants and so on give us their hours and how to contact them and how to get their goods, and then that's posted up on the Chamber web page, and we also post new information on Instagram on a regular basis. That's through the Orange Chamber, so that would be at Orange Chamber. If you have a business and you want us to post it, you don't have to be a chamber member. We're just trying to get the word out for everybody, so you can contact the chamber either by going to their website, or you can go to Irma at orangechamber.com. Another project that we've been working on for the last couple of years is the Panther Experimental, I won't get it right, Experimental Philanthropy Project. We've been working with the Atala College of Educational Service. This is a new program where the students actually write grants for different nonprofits, and then they vote and decide who should get the grant. It's teaching the students to be a part of the community and a part of giving back to the nonprofits. We were kind of concerned because this is an interviewing process that has to take place, but the students and the faculty got together, figured out how to do it all virtually, and we're moving it along, and they're in the interviewing phase now, and we'll be distributing about $6,000 to nonprofits in May. We have been working with the OUSD on their food distribution. You know that the schools are all closed, and a lot of the students need the breakfast and lunches that they could get. So Waste Not OC and the Orange Rotary has been working on drive-up food sites, and we've been involved in volunteering there. In one day, we gave out 800 meals in less than 3 hours. So that shows you the need that's there. And then lastly, Mayor Murphy mentioned it, but we opened up the Orange Homegrown Market, Farmers Market last week. We're pretty proud of that. We did shut it down in the beginning because of the social distancing or physical distancing, but we worked out a system that you'll see chalk marks all along Palm now. And last Saturday we had people in line from walking into the market all the way down to the city parking structure on Maple. Nobody waited in line more than 30 minutes though. We've limited it to vegetables and necessities, so there's no extra. It's not a social hour. You come in and get what you need. And we've checked all the state and county guidelines, and we're making sure that we stay within them. I know that the community is thrilled about it, and that the farmers are also very happy that it's back. With that, I'm going to turn it back to Collette. Before I do that, I want you all to just stay healthy. We're going to get through this together. We're all one community. We're all here. We just stay calm, stay healthy, stay safe. Collette, back to you.
Thank you so much, Jack, and I want to thank everyone for those insights and opening up those windows into so many areas of engagement on the part of the experts of Chapman, and we are very fortunate to have this wealth of knowledge and commitment. I want to turn now. We've got about a little over 15 minutes and questions have been coming in. So we're going to start with the first question, and this one is for the mayor, and I'll dive right in. This is for Mayor Murphy. My sister is a small independent business owner, and she's the sole provider for a family of 6. What resources, financial or otherwise, are available to small business owners in Orange right now? We see businesses going out of business. What is being done to help?
Well, thanks for that question. And first and foremost, it's not lost on anyone how painful this pandemic is for the business community, both small and large, and especially as a sole proprietorship and the breadwinner for a family, that becomes very immediate and very timely that those resources are required. The city's been coordinating with the Chamber of Commerce as well as the Small Business Administration to help people find resources available that are being offered through federal and state grants. And I would encourage this individual to contact either my office. We have an individual that's responsible there. That would be Susan Galvin. But if it's easier, just email me and use the code word Chapman so that I know it's you that was on here and asked me the question, and we'll get you connected to the right folks. Irma Hernandez, as it was mentioned earlier by Jack at the Chamber, along with our city folks, to make sure that you're in line for the resources that are available. I will say those resources, you need to be timely on the applications of those resources because they certainly aren't endless, but there are monies out there, and we want to make sure and get Orange businesses in the front of the line.
Great, thank you, Mayor Murphy. So the second question, and this one for President Struppa. Are we anticipating Chapman will resume classes in the fall? And if so, what do you anticipate to be in place to prevent outbreaks?
Thank you, Collette, and thank you for the question. Believe me, this is first and foremost in my mind virtually every day. So we have put in place a couple of scenarios, and the one that we think is the most likely is that we will be able to open in the fall with face-to-face classes. As you understand, this cannot be a promise because the government obviously can impose further quarantine states, and so we will have to obviously follow the law, but we expect that we should be able to do it. We also expect that these classes will resume under some degree of restriction on social separation. So, for example, we expect that there may be limits to how many people together can congregate. Now, Chapman is fortunate because most of our classes are very small. So if they say we don't want more than 50 people in the same classroom, well, that's not going to be a problem for us because virtually all of our classes are under 50. If they say everybody has to be under 20, then that may be presenting some additional problems. And the way we are thinking to address that would be, for example, to have classes that meet multiple times during the week, separate them in a way that half of the class, say on Monday, half of the class would meet on Wednesday, and the time that you are not in class as a student, you'll be able to see the class being delivered by via video. And so in preparation for this, we are actually making a significant investment in new technology to provide technology in every classroom so that this is possible. We also expect that if we resume classes and there are social separation regulations, we're going to have a significant amount of materials on campus to help prevent outbreaks. You heard that the dean of our Fowler School of Engineering talking about masks, we actually received a very significant donation from a very generous donor that will be used to provide the university with everything that can help preventing outbreaks. Masks for students and for faculty and staff, hand sanitizers, thermometers that can be used to evaluate whether people are running a fever, and possibly even testing that we could deliver on site. So we are actually working very actively to make sure that we provide every possible way to prevent what they call the second wave. But thank you for this question, and believe me, that is really what is absorbing most of my time right now. I had a big meeting today with the Finance Committee to authorize exactly this kind of actions. Thank you.
Thank you, President Struppa. And you, I think, in a sense, answered the third question, but this would be both for you and for Mayor Murphy. The third question being, will there be a stepwise process to reopening the City of Orange and Chapman University?
You want me to lead off,
Yes.
Daniele?
Yeah, go ahead.
Okay, sure. I mean, we are looking at all possibilities and alternatives following the lead of the governor's office with the executive orders and some of the guidelines there, as well as from the Orange County Healthcare Agency in terms of the science of it and the risks involved, et cetera, and have done that since the beginning. I would have to guess from my end of things that it will be phased in. That's what's been discussed over time, and you're even seeing modest beginnings of that with golf courses being reopened in the county here over the last couple of days with major restrictions, certainly all the social distancing and the rest. So I would assume it's a phased endeavor. I would love to say that I had a date that I could tell you it was going to happen, but we're going to rely on the science as well as following the executive orders of the governor and make sure that things are done in an orderly and safe manner.
Yeah, I would second what the mayor just said. The answer I gave to a previous question kind of hints at the way we are thinking about it. My forecast, I mean, I'm not a betting man, so I don't count on it, but my forecast is that we're going to have this kind of separation, and therefore inability to reopen the university for probably another month or two. After that, we're going to be able to have classes with some form of social distancing in place. And then eventually I expect that by the spring semester, we'll be able to resume classes normally. So anyway this will work out, it will be gradual because we will see the slow decrease of the infection. And so then some of the restriction being lifted that will allow the university to reopen. And my estimate again is that hopefully by the fall, we'll be able to have classes face to face.
Wonderful. Thank you. And now a question for Dean Hill. You spoke about physician assistants who are working in the hospitals and service to the community. Can you offer any guidance for folks who are starting to petition leaders to lift orders? How might this type of move affect your students on the front line?
So I would say that right now, if you looked at the most recent data in Orange County, that we continue to have escalating number of cases in certain communities. Huntington Beach, I believe, is one, maybe Santa Ana, Anaheim. So we are really not past a crisis yet. And so to reduce restrictions at this time, we would lose some of the momentum that we've already gained in trying to corral this virus. So I would say to folks, we still need to practice social distancing. We still need to wash our hands. We still need to wear a face mask when we're out in public and we're interacting with other people. We need to not reduce what we've been trying to do. We need to continue to be socially responsible. And then that means that we have fewer of our frontline providers that will be exposed to such high risk. Right now, our students in the PA program are not involved in the clinical setting. That's because hospitals and healthcare settings are still short of personal protective gear. And it's most important that those that are highly skilled get that gear and the students who are less adept at being clinicians, that they need to step aside and allow the practicing clinician to have access to the gear. So I think we want to be able to train our students. That's going to have to step aside a bit while we deal with this crisis. The best way to deal with this crisis is for us to pay attention to what our leaders are telling us about socially responsible behavior.
Great. Thank you, Dean Hill. And now a question for Dean Jordan. What do we know about the safety of some proposed medication therapy for COVID-19?
There's a lot of information on the internet and flowing through the media that people need to be careful about and need to be thinking of their safety very carefully before trying something that is not completely proven yet. One of the areas is hydroxychloroquine safety, a drug that has been touted by some as being an important addition. While it works in some people, one of the key things about it is in the elderly, it causes heart arrhythmias by lengthening the QT interval in the heartbeat. And that lengthening of the QT interval is an important area that many drugs affect. And so depending on the therapy that someone is on, they could just draw the wrong card and be issued hydroxychloroquine and end up with a heart attack almost immediately. So we know that drug needs some work. The FDA put out this morning a special warning on it so that people would recognize there are serious cardiac issues that need to be watched for. And I would add to that the drug therapy that someone is currently on makes that warning even more important. There are things coming that I think a lot of people are working on very hard right now. I am hopeful that we will see some very positive therapy that can make a difference in people. Some other people may have read about remdesivir that is being studied by Gilead, and the fact that the study that they've done so far has been inconclusive because not enough people have been enrolled in it. There is some hope with that drug if it's used early enough in therapy, and hopefully that and some others that are being worked on, as well as coming vaccines, will make a difference in this fight. Thank you.
Thank you, Dean Jordan. And now a question for Dr. Piechota. This is a question, can you speak to what the research is showing regarding the move to lift shelter at home? Is it safe to do so at this time?
Boy, that's a tough question. You know, it's hard to, much of lifting the shelter at home is directed by our state and local authorities. And from one standpoint, it's actually taking a regional approach now too. Much of the Western states between Washington, Oregon, and California are very much kind of looking to see how they work together and how they're connected as communities too. So I think much of what we do, as President Struppa said, and as the mayor said, we look to our state and local authorities in terms of what the restrictions are and the lifting of those restrictions. As an institution, we hope to inform that in terms of the work that we're doing also, you know, and I think that's very much the things that go into consideration in making those decisions are around testing, the use of social distancing, and the proper PPE in terms of when people go back to work and people go back to school also. These are the things that we're looking at as a community. And then the last thing I would say, you know, is we do have some interesting research in terms of, and it gets at the issue of the broader kind of regional connections, whether that's regional between counties or regional between states. And we have this interesting project where we work with Facebook and Data for the Good, because it shows the connectivity, because when you do open up the economy, we have a lot of people that work here in Orange County, let's say, that come from Riverside County. So we, as a county, it may look good, but we have to be aware of what's going on in Los Angeles County, what's going on in Riverside County, because we have a lot of workers that come from there also. So we have some really good, interesting research where they've used data from users of Facebook to look at some of those connections and work with decision makers to kind of help inform them as you make those regional decisions.
Thank you, Tom. And now for the mayor, if we could return a question about how do you plan to respond to the scheduled protest in the Circle on Monday? Are steps being taken for those concerned mass gatherings at the Circle violating the stay-at-home orders? Many are concerned that over 200 people are expected. Mr. Mayor.
Oh, well, thanks for that one. Hey, first and foremost, I want to thank the people that had sent me email about this possible event over the last several days, both with views that things should open tomorrow and views that we should stay safe and follow the guidelines from our state and local and county officials. I appreciate you taking the time to let me know about this. 7 days a week, 24 hours a day, 365 days a year, our priority in Orange is to make sure that our residents, our visitors, our businesses, and anyone involved in the community are safe. And Monday will be no different than any other day from that particular perspective. So I can't really say much more than that at this point, wouldn't be appropriate, but I do appreciate those that have brought it to my attention. And I also would just encourage everyone, the best advice I can give you is stay home and stay safe, just like you've heard multiple times today. Thanks for the question. I do appreciate the opportunity to be able to address it here publicly.
Yeah, thank you. We have one more question to in closing, and I will put this one out for Daniele and the mayor, and then we will be wrapping up. And that is, how can people support the community, volunteer, or help while the stay-at-home order is in place? Mr. Mayor, would you like to start?
Well, I would just say there are a number of organizations that are looking for help, and that some of that help is required with folks doing things at home and then having deliveries and pickups. Others are more an active role depending on the business or the entity involved. I would say if you're not sure where to look, you can send myself a note at my email's mayor@markamurphy.com. Be sure and get the middle initial in there, otherwise you get a jazz singer who has passed on and his family doesn't seem real interested in the city of Orange. He's actually from down in New Orleans area. So anyway, but all joking aside, if you have extra energy and you want to share whatever your time, whatever your talent or treasure for that matter, there are a number of opportunities and we'll find one that works for you. Certainly the Community Foundation is a great fundraising campaign around building of signs that you're seeing start to sprout up around the community. And I can go on and on, the different charities. Waste Not OC was mentioned earlier by Jack. There's another great one. And I suspect, and I don't want to take all the time on this one, I suspect that the university has a number of activities along those lines as well where people could channel their energies. But I appreciate the desire to help, because I think that's the way we get to back to the new normal, if you will, the quickest.
Great, thank you, Mr. Mayor. And as I asked President Struppa to close up and wrap up for us, let me just say how great the questions have been. We're sorry we haven't been able to answer all of them, but we will find a way to post those. So President Struppa, would you wrap up? Thank you.
Sure. Happy to conclude this. Well, first of all, on the question of what you can do for the community, I think maybe the number one thing is to stay healthy and to abide by the request that everybody has made to keep separated and suffer through this for a little longer. That's certainly the most important thing that we can all of us do, and that's why we moved the university completely remote. That's why you see all of us communicating with you from home. So that's my number one comment. The second comment, if you have the energy as well as the financial means, there are lots of charities that need your support, and you can choose any one of them, and you're not going to go wrong. There are homeless shelter that needs your help. There is the OC Charities that needs help. There is the Catholic Church that needs help. And as kindly Mayor Murphy has pointed out, Chapman is having his Giving Day on April 28th. And we are raising money, quite frankly, to support students whose families have become unable to pay the tuition. One of the most heartbreaking part of my job is to receive notes, and we did that, I remember, back in 2008 when there was the other large crisis, receive notes in which the parents tell us, you know, Chapman has been a dream for my son or my daughter for many years. She's now a junior. I lost my job and I can't afford to pay for her. Well, that's heartbreaking, and that's what we do, is to try to come through for them. And so every dollar that we are raising right now is going to go to the support of the students. Let me close by saying thank you for all of your questions. We really appreciate your attention. You're being engaged with us. You're stimulating us. We have collected other questions that we'll try to respond individually. I want to thank everybody who has joined me on this town hall, starting with my friend, Mayor Murphy. Thank you again. And everybody else, all of my vice presidents and colleagues. It's an honor. It's really an honor to be partnering with the City of Orange. It's a great partnership, and I know that the future, this is something that the mayor said at the very beginning, and I want to repeat it because it's important. He made the comment out together of this stronger than we were, and I know it's true. I'm extremely optimistic. The way everybody has responded shows me that this is the truth. So in the meantime, stay safe, stay strong, and we hope to see you again at the next one of our events. Thank you very much. And thank you, Collette, for moderating all of this.
Thank you.